Hey everyone, this is Dr. Mark Nelson. I just wanted to have a brief conversation with you about diabetes and prediabetes because so many Americans have one of these conditions, or you may know someone who does. So I just wanted to share some information because there are a number of myths out there about diabetes and prediabetes that are simply not true. So I'm going to share my screen, and I hope you are open to staying with me for just a few minutes while we talk about empowering yourself, busting the myths about type 2 diabetes and obesity. As you may know, my wife and I are COPE certified health coaches, and our focus now is helping people get healthy. So let's look at the myths versus the reality with respect to type 2 diabetes, prediabetes, and obesity. So there are two big myths about type 2 diabetes and prediabetes. There's also one big myth about obesity, many more, but one big one that we'll talk about as well. So let's start with diabetes. What are the two big myths? Well, first of all, that diabetes is a chronic progressive disease. And as far as type 2 diabetes is concerned, which is what most diabetics have, this is simply not true. And the second is that lowering blood sugar should be the primary goal of therapy. Now, according to the CDC, there are now 115 million Americans who have diabetes or prediabetes, as you can see from this graph. We also know that 15 to 30% of people with prediabetes will develop type 2 diabetes within 5 years without losing weight and exercising. Now, it's also important to remember that 5% of diabetics have type 1, which is genetic, but 95% of diabetics are type 2 diabetics. And in most cases, as the CDC also notes, this can be prevented because this is really about lifestyle choices. As I've said, half of US adults have diabetes or prediabetes 90% of the time. It's because they are overweight and as a result, unhealthy. So what is myth number one? Well, myth number one is that, as the American Diabetes Association says, which may be surprising, but unfortunately it's the truth, they would have you believe that for most people, type 2 diabetes is a progressive disease. This is a myth. It is simply not true. In fact, we've known this for a long time. For example, this slide comes from the New England Journal of Medicine, 2002, a number of years ago, where we learned that with diet and exercise, pretty modest to be sure, people who are pre-diabetics dramatically reduce their risk of becoming full-blown type 2 diabetics just by losing a little bit of weight and exercising a little bit. In fact, the risk reduction was greater than people who are put on metformin, which is a medication used to treat type 2 diabetes, and in some cases prediabetes. So lifestyle changes have been known actually for many, many years, predating 2002 in fact, to be able to result in dramatic improvements in people's health if they had prediabetes and type 2 diabetes as well. This study, Reinventing Type 2 Diabetes, was published in 2008. And what it's really telling us is that diabetes is really not about blood sugar, but about excess calories and fat. This is what they mean by the lipocentric concept. So according to this paper, first, there has long been evidence that relatively modest weight loss by caloric restriction, by exercise or both, can reduce insulin resistance and hyperglycemia or high blood sugar, even if it fails to achieve its desired cosmetic goal. In other words, overweight individuals should restrict calories to prevent disease, whether or not optimal weight loss is achieved, meaning losing even a small amount of weight can have a dramatic impact. The author goes on to say the preferred strategy to correct high blood sugar hyperglycemia is to eliminate its proximal cause, which is caloric surplus, meaning eating too much. Reductions in weight and waist circumference can reverse prediabetes and impaired glucose regulation. This is a study done recently, published in 2016. So we know that if people can improve their choices, their lifestyle, lose weight, improve nutrition, that they can reverse prediabetes and improve glucose regulation and type 2 diabetes as well. Now, this slide comes from the Cleveland Clinic. It's modified to some extent. But what you see here is the healing effects of weight loss. And these numbers come from the original slide. For type 2 diabetes, you can see that in this paper that was published, there was 83% resolution of type 2 diabetes. Now that means cured. Other papers have shown cure rates of 90% for type 2 diabetes. And we can see similar changes for many diseases. Cardiovascular disease, 82% risk reduction. High blood pressure, 52 to 92% resolved or cured. Metabolic syndrome, 80% resolved. So we know that when we reach a healthy weight, we can see dramatic improvement or complete resolution of a host of diseases and medical problems for which many people take many medications. What is myth number 2? Well, unfortunately, this is also propagated by the American Diabetes Association. They would have you believe that eventually, if oral medications may not be enough to keep blood glucose, blood sugar levels normal, they would have us believe that using insulin to get blood sugar levels to a healthy level is a good thing, not a bad one. Well, actually, if a diabetic needs more insulin, it means their disease is getting worse, not better. In fact, we know that if we engage in intensive glucose lowering, using insulin and other medications, this can lead to worse outcomes. This study showed the effects of intensive glucose lowering in type 2 diabetics in the New England Journal of Medicine in 2008. And in fact, they found that the use of intensive therapy for 3.5 years increased mortality and did not significantly reduce cardiovascular events. Not only that, low blood sugar and significant weight gain of more than 10 kilograms, which is over 20 pounds, that was more frequent in the intensive therapy group. So it's very important to understand that insulin, though it may control blood sugar, needing insulin or more insulin doesn't mean type 2 diabetes is getting better. It means that it's getting worse. Think of it this way. If someone has pneumonia and you're giving them cough syrup to control the cough, which is a symptom of pneumonia, just like high blood sugar is a sign, a symptom, if you will, of type 2 diabetes. If someone with pneumonia needs more cough syrup to control their cough, is their pneumonia getting better or worse? Well, obviously, it's getting worse. So instead of giving cough syrup, if we address the root cause of the pneumonia, for example, an antibiotic, which can cure the pneumonia, we won't even need the cough syrup. So insulin can obviously result in weight gain, and needing more and more insulin again means type 2 diabetes is getting worse, not better. What is the truth about type 2 diabetes? 90% of patients with type 2 diabetes can be cured without drugs or surgery. And treating blood sugar, as I've said, is like giving a cough suppressant to someone with pneumonia. It is treating a sign, a symptom of the disease, not the reason for the disease itself. Living a healthy lifestyle is the cure for many diseases, including prediabetes and type 2 diabetes. Healthy choices and healthy habits, including losing weight, reducing high glycemic carbohydrates and the calories associated with those, healthy nutrition, regular exercise, restful sleep, can have a profound impact on our health. Now, let's look at the complications of type 2 diabetes. These are pretty serious: blindness, kidney failure, often necessitating dialysis if it goes on for years, heart disease, heart attacks and death, stroke, and amputations, due to the vascular disease that type 2 diabetes can lead to if it is allowed to be a chronic disease, then leading to the amputation of toes, feet, or legs. In fact, hundreds of thousands of lives are lost every year in this country because of these complications. Now, many people would have you believe, and the American Diabetes Association would have us believe, that these complications are a natural and inevitable part of the disease process. That is a myth. It is not true. Type 2 diabetes can be cured 90% of the time. And obviously, if there's no disease, there are no complications. So these are the two big myths: that diabetes is a chronic progressive disease while it is curable, and that lowering blood sugar should be the primary goal of therapy. The primary goal of therapy should be helping people get rid of their diabetes. Why do these myths persist? Why is the truth hidden? Why are diabetics often told by their doctor, you have type 2 diabetes, there's really nothing you can do, here's the pills, here's the medication? Well, this slide, by the way, also comes from the American Diabetes Association. And this slide does, in fact, have some truth in it, namely that diabetes and prediabetes cost this country $322 billion a year, and that number has probably risen since this slide was created. In fact, 1 in 5 healthcare dollars is spent caring for Americans with diabetes or prediabetes. There's a lot of money in the system. It's going around. It's an expensive disease. There's a lot of cost, a lot of bills are being paid, and a lot of profit is being generated. Type 2 diabetes is a big moneymaker in this country. By 2015, sales of diabetes drugs had reached $23 billion, more than the combined revenue of the NFL, NBA, and Major League Baseball. From 2004 to 13, no less than 30 new diabetes drugs were brought to market. In fact, if you look at the academic experts who sit on the panels that come up with the policies and the recommendations in 2008, 13 of the 17 panel members were paid as speakers and consultants for diabetes drug companies. And in 2013, 13 of 19 doctors on the panel, including the chairman, were paid as speakers, consultants, and advisors to pharmaceutical companies making diabetes drugs. Over $10 million was spent by these drug companies to influence the recommendations of these panels. Now, what's one of the newer recommendations? This is pretty frightening, actually. Another recommendation, and this was published in Diabetes Care, the mouthpiece of the American Diabetes Association, asserting that standard therapy should now include bariatric surgery for type 2 diabetics. So what are they saying? They're saying that you could redesign your life, your thinking, the way you live, your habits, and we know that we can see improvement and curing of type 2 diabetes and prediabetes by simply changing the choices we make and adopting healthier habits. But they would rather have you redesign your life. They actually would rather have you redesign your intestines than redesign your life. And they are now recommending that bariatric surgery be recommended as one of the initial treatment options for type 2 diabetics. That, in my opinion, is pretty frightening. And when you look at what goes on in bariatric surgery, I think it's self-evident that this is forced portion control, and this is pretty serious surgery, which is also extremely expensive. The choice we have, of course, is to redesign our life instead of our intestines, which we can do ourselves, certainly with help if we want it. I just picked one of the surgeries to show you the complications that can occur. These surgeries are obviously not without significant risk. This here is a list, and this comes from the Obesity Medicine Association, by the way, of the most common chronic complications of just one of these surgical procedures. Now, we also know that managing disease does not create health. it certainly doesn't equal health. Because managing disease is a fundamentally different choice than helping patients get rid of diseases and get healthy. Curing disease is possible most of the time. Why would we choose to manage it? We, in fact, empower diseases to be chronic by not helping patients move their health forward and get rid of diseases and medications, which themselves can have significant risk. Actos, which is a medication used for diabetics, was linked to a 63% increase in bladder cancer. So we have many, many people who have taken Actos who either contracted, came down with bladder cancer as a result of that medication, or are at risk because they took a medicine that increased cancer risk. Now, we also know that one of the complications of type 2 diabetes, if it's left to progress, is limb loss, as we noted before. One of the newer class of medications, and this is one of them, called Invokana, is used to treat type 2 diabetes. It has also been the subject of an FDA and European Medicine Agency warning regarding an approximately twofold risk of leg and foot amputation because of taking this medication for diabetes. And it's previously been linked to higher rates of bone fractures and diabetic ketoacidosis, which can be a life-threatening complication as well. So think about it. Here's a medication, and it's not the only one in its class, by the way, one of the newer ones, that now has a warning regarding a twofold excess risk for leg and foot amputations, when in fact the very thing we're trying to prevent theoretically by treating type 2 diabetes is amputation and other complications that we talked about earlier. So what are we talking about here? Limb loss from type 2 diabetes or from its treatment? This obviously makes no sense at all. Let me also share with you that type 2 diabetes itself is associated with cancers. And that's very important because when we cure type 2 diabetes, which we can do, of course, by adopting a healthy lifestyle most of the time, we obviously can reduce our risk of developing cancer. So people with type 2 diabetes have higher rates of pancreatic cancer, 1.82 compared with 1, which is no increased risk. Higher bladder cancer, 1.43, also could be related to Actos that we've just mentioned. Higher rates of liver cancer, breast cancer, endometrial cancer, kidney, and others. Now, the one cancer here that actually has a lower risk is prostate cancer. That is felt to be due to lower testosterone levels in men who are obese. But you can see that diabetes has many risks for people long term. The longer it is a disease that exists for a patient, and these risks are many, including more cancers. Now, it's very important to understand, as I've been saying, that prediabetes and type 2 diabetes do not need to be chronic diseases. They are, the vast majority of the time, completely curable. People can move from their current health path to a new health path, which is really about learning healthy habits, changing the design of our lives, prioritizing our health, allowing our bodies to heal. We can move beyond sickness to health if we want to. Or we can just let the sick care system do what it does naturally, which is tests, procedures, medications, and surgery. It's really a choice each of us has. The choice is really about, do we want to stay where we are with sickness and disease, or on our way to sickness and disease, or really create health for ourselves by learning some new healthy choices and habits so we can improve our health, which is an opportunity for each and every individual who wants to make those choices. We're talking about 5 core habits of health. Obviously, healthy weight loss and maintaining a healthy weight is one important part of that. But healthy nutrition is as well, healthy eating, healthy movement and motion, healthy sleep. Sleep is critical to our physical, mental, and emotional health, as well as healthy stress reduction. And these are all things that we offer with our Take Shape for Life program. It's very important for people to understand that these healthy habits can allow any individual to transform their health in important and powerful ways. This is Tom, who did our program. His doctor shared it with him. Tom had type 2 diabetes, and as a result of healthy habits, improved nutrition, losing weight safely, improving his movement and sleep and more, and obviously weight loss being a very important part of this, Tom's type 2 diabetes went away. He no longer has type 2 diabetes and is no longer on type 2 diabetes medications. The point being, as I've said, that even if you've had type 2 diabetes for many, many years, 90% of the time it can be cured simply by learning and practicing healthier habits. This is Teresa, who had prediabetes, which resolved as a result of safe, rapid weight loss. She also did our program, learned many healthy habits. As you can see, there were significant improvements. Her blood pressure medication was discontinued. Her Acifex was discontinued. Her cholesterol improved and more. So health certainly has its benefits. And this is David, who wanted to buy a sports car but couldn't fit into it as a result of safe, rapid weight loss. He had dramatic health improvements as well. He was able to discontinue his blood pressure medication. His prediabetes completely resolved. His medicine for cholesterol improved. He obviously did very well. He was able to lose weight, improve his habits, and move his health forward. Just another example of an individual with prediabetes who not only never developed type 2 diabetes, but his prediabetes resolved as a result of his learning habits of health and creating healthier choices for himself. Now, I want to talk about obesity and overweight for a minute, because there's one very big myth about obesity, which of course is also not helping people at all. And this is that obesity is a chronic disease. It is not a chronic disease. I've already shown you examples of people whose obesity has been cured by learning healthy habits, losing weight, and improving their choices because they've chosen to prioritize their health and learn new healthy habits. This guideline actually is very interesting because the focus is not on healthy lifestyle at all. The pharmacological or drug aspect is the engine of the guidelines, according to the co-chair, Jeffrey Mechanic, who is listed here. So he would have you believe that obesity is chronic, that there's nothing you can do about it, the only solution is medications and drugs. That, of course, is not true. This is Josephine Shaw, who is not only obese, but had type 2 diabetes. And as a result of losing weight, improving her health, she also did our program. Her type 2 diabetes was cured. And her other health problems improved dramatically, as you can see. She got off cholesterol medications, and her blood pressure became normal as well. Now, it gets worse, unfortunately. The FDA has now approved a weight loss stomach pump, which will actually, if one chooses to do this, I hope no one does, a trocar is inserted through the abdominal wall into the stomach and basically sucks stomach contents out into the toilet. Seriously, this is not a joke. This is really pretty scary. This was just approved. It's a weight loss stomach pump approved by the FDA. I really don't know what they're thinking. But when we can help people improve their health, lose weight, and get rid of diseases and medications, why wouldn't we want to do this? Obesity is not a chronic disease. It was not a chronic disease, is not a chronic disease for these individuals who were able to transform their health. These are individuals who did our program, and these transformations are quite remarkable, as you can see. Many individuals who chose to learn a new health path, new choices and habits, for them, obesity is not a chronic disease. Take Shape for Life is a comprehensive healthy lifestyle program that includes weight loss. But we don't stop when people reach a healthy weight, which they can if they choose to. We help people learn how to move their health forward, learning a simple system and orientation based on a healthy mind of new healthy choices and habits, so you can now be in control of your weight and your health for the rest of your life. We have a Habits of Health system, which is the foundation of our program, which is about new healthy habits, because long-term health and healthy habits go together. We can guide people on a path so they can improve their health in so many ways. Overweight and obesity are preventable and curable, as is prediabetes and type 2 diabetes. And I want to emphasize that because many people are operating under the myths that have been propagated by the sick care system, that these are chronic diseases that they really have no control over. That is simply not true. In fact, we know that 93% of heart attacks are preventable. We know that half of cancer deaths are preventable. We know that 80% of strokes are preventable. And we know that 90% of diabetes and prediabetes are preventable and curable. That's where our focus can be and should be. The truth is that type 2 diabetes and prediabetes come from being overweight. 90% of the time they are curable. Diabetic complications are not inevitable. And overweight and obesity, as I've shared with you, are curable without drugs or surgery the vast majority of the time. So why are we having this conversation? Because if you have type 2 diabetes or prediabetes, and you would like to get rid of those diseases, or at least improve your health significantly, you can. The choice is really to manage disease for years and years and years with more medications and more surgery, or empower health, because most of the health problems Americans have are preventable and curable. Your health is really in your hands. It's in the choices that you make. And our program is very powerful because we simply guide people to and on those choices and new habits. So instead of your being at the mercy of a sick care system, which quite frankly is disease-centric, not health-centric, instead of being at the mercy of that system, you can actually move your health forward. And I'm not saying that the sick care system does nothing good. In case of an acute accident, it can be very helpful, but it certainly is not able to deal with most of the diseases that become chronic diseases because of the failure of the sick care system to really help people get healthy. That's something you can certainly do if you choose to, and that is what our program is designed to do. Creating optimal health and well-being is a choice of each and every person. And I wanted to share these insights with you because the myths that are propagated are really teaching people that they can't do this. And in fact, you can. We would be happy to help you. If you have type 2 diabetes or prediabetes, my wife and I are health coaches. We'd be happy to help you improve your health and create health for yourself. And if you're not a pre-diabetic or diabetic, but you know people who are, we hope you'll pass this information forward. My email and phone are here. Please feel free to reach out to me at any point. You can pass it on. And we have helped people reduce their diseases, get off of medications, improve their health. Many people tell me that their life has been saved because of their learning healthy habits, which usually began by their doing our program. So please feel free to share this information. If you have any questions, don't hesitate to reach out to me. I hope this has been helpful. I really think that it's terribly important that people understand that the myths that have been propagated about diabetes, type 2 diabetes, prediabetes, and obesity are not helpful to people. We can, in fact, cure and reverse these diseases 90% of the time by simply learning and practicing healthy habits. Thank you, and have a great rest of the day.